You know, we've been promised that this government-run plan will improve access and care, as well as competitive private market plans, or be competitive with the private market. I don't believe that. Mr. Brady's amendment would make sure the government is held to that promise by repealing the market-run plan if wait times exceed the average wait time for enrollees in the private insurance sector. The reason that this needs to be put in with the government plan is the free market works in the private sector now. If services aren't being effectively delivered, one thing happens: people change their plan and move on to something that will get them the care that they need. No different than buying a different car if you're not satisfied with the one that you have. If over 100 million people are moved to a government-run plan, as the Lewin Group predicts, you might have a card that says you're covered, but if you can't find a provider that will do that service, it's worthless, and that's a real concern to many of us, particularly with our concerns in rural health care. Some examples of wait times in Canada and the United Kingdom have been mentioned already, but the list goes on and on and on, as each new case is quite simply offensive. 18 months on a waiting list in Canada for bypass surgery is a huge cost to the public treasury when you multiply the lost work hours compared to almost immediate service and surgery in America today. In the UK, NICE guidelines state that patients should receive treatment within 3 months of first symptoms of rheumatoid arthritis appearing. That would result in a liability suit that many of my colleagues on the left side of the aisle would actually support if that were to happen here in the United States. That seems too long, as is the average wait time. Actually, in reality, is 9 months in England for that same treatment. And even then, general practitioners are not trained well enough to know what help to offer, as opposed to seeing a rheumatologist, which an American patient would. And it requires multiple office visits. As you may know, diagnosing and treating rheumatoid arthritis within the first 3 months is critical because drugs can limit its progression and thus reduce the public health care cost in the long run. The median wait for an MRI across Canada was 10.1 weeks. Patients in Ontario experienced the shortest wait, 7.8 weeks, while Newfoundland and Labrador residents waited the longest, 20 weeks. In the United States, over 90% of seniors receive a hip replacement within 6 months. In Canada, less than half of patients are treated in the same time, 43%, with many waiting over a year. In the United Kingdom, only 15% of patients are treated within 6 months. More than 725,000 Canadians idle away on months-long waiting lists for surgery and other critical treatments. It's no coincidence that the survival rates for breast cancer and prostate cancer, respectively, in Great Britain lag the United States by 14.2 and a whopping 40.8 percentage points, respectively. This bill fails to include adequate structural changes to the system that could succeed in lowering costs and increasing access to care. We can't simply add millions of new consumers to a broken system. Doing so will only exacerbate the problems and reduce patient satisfaction. All you have to do is look at other countries for the results. Instead of enacting meaningful reform like re-engineering the payment and compliance systems through CMS, as I've offered in the past, and private insurance tort reform, we're today considering a measure that wraps the complexity and inefficiency of government around a dysfunctional system. We're avoiding the problem. This proposal does not present a solution. Proponents of the public option plan claim it will compete with private insurance. Many have discussed the cost side of that promise. However, if the plan can't live up to the adequate care side of the promise, then the plan should be discontinued. I urge you to support Mr. Brady's amendment, and I yield back.